and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Malaria is a life-threatening illness caused by the Plasmodium parasite transmitted to humans through the bites of infected Anopheles mosquitoes. At the onset of the disease, one experiences fever, chills, headaches, muscle ache, nausea, sweats and vomiting. Complications of malaria include kidney failure, seizures, that is fits, coma and death. World Malaria Day is observed every year on April 25th to raise global awareness about the deadly effects of malaria and to promote efforts towards eradicating it. Today in Wellness Watch, we discuss malaria. I'm Preeti Kaur. Malaria, one of the oldest and deadliest diseases known to humankind, continues to grip millions across the world each year. World Malaria Day, observed on April 25th, serves as a powerful reminder of the ongoing threat and a call to intensify efforts towards ending it. We delve into what causes malaria, its symptoms, ways to prevent it, and the treatment that is saving the lives. Here's our special report by DD India's Harshita Oberoi.
Malaria, a life-threatening disease caused by the Plasmodium parasite, strikes without warning, spreading through the bite of an infected female Anopheles mosquito. It invades silently, its symptoms unfolding into fever, chills, diarrhea, headache, muscle pain, and in severe cases, jaundice, anemia, and even coma. For many, malaria attacks come in cycles of shivering, burning fever, and heavy sweating. An exhausting, dangerous spiral. The scale is staggering. Today, malaria threatens nearly 200 crore people across 90 endemic countries, along with 12.5 crore international travelers. While some survive, many, especially young children, are not as fortunate. The disease strikes hardest where poverty, lack of healthcare, and warm climates give mosquitoes a free rein. At the heart of the crisis lies a deadly cycle. An infected mosquito bites a human, releasing parasites that travel to the liver, mature, and attack red blood cells. Risk factors loom largest for young children, pregnant women, travelers to endemic regions, and anyone living where prevention efforts are weak. Left untreated, malaria can spiral into cerebral malaria, respiratory failure, organ damage, or deadly anemia. Yet, malaria is not inevitable. Protection is within reach. Covering up at dusk, using mosquito nets treated with insecticides, applying EPA approved repellents, and taking preventive medicine can drastically cut the risk. Timely diagnosis, usually through a simple blood test, can detect the parasite early, and modern treatments with anti-malarial drugs can save lives. Each year on April 25, the world marks World Malaria Day, reinforcing the message that malaria must and can be defeated. This year's theme, Malaria Ends With Us, Reinvest, Reimagine, Reignite, calls for renewed commitment, innovation, and bold action to end malaria once and for all. India's own battle against malaria tells a story of determination. Between 2017 and 2023, the country recorded a dramatic fall in malaria cases and deaths. In 2023 alone, 122 districts reported zero cases, a remarkable milestone. By 2024, India proudly exited the WHO's high burden to high impact group, a significant global recognition of its success. India's fight against malaria stands as a testament to resilience and strategic action. The National Framework for Malaria Elimination, launched in 2016, laid out a clear roadmap to achieve zero indigenous cases by 2027. The establishment of national reference laboratories at the National Center of Vector-Borne Disease Control has enhanced diagnostic capabilities across the country. Integrated vector management with measures like indoor residual spraying and the widespread distribution of long-lasting insecticidal nets has been central to reducing mosquito population. On the ground, community health officers and Ayushman Arogya Mandirs have played a critical role in delivering malaria services directly to communities, bringing India closer to its elimination target. Malaria is a disease we can prevent, treat, and ultimately eliminate. Through relentless innovation, continued investment, and strong community action, a malaria free future is not just a dream, it is a goal within our grasp. Harshita Oberoi reporting for Wellness Watch, DD India.
All right. Malaria is a parasitic infection transmitted by the Anopheles mosquito that leads to acute life-threatening disease and also poses a significant global health threat. 2 billion people risk contracting malaria annually, including those in 90 endemic countries and 125 million travelers. The Plasmodium parasite has a multi-stage life cycle which heads to cyclic fevers. With timely treatment, most people experience rapid resolution of symptoms. However, significant complications may occur, including cerebral malaria, severe malarial anemia, coma or death. Today in Wellness Watch, we look forward to the following questions. What causes malaria? How is malaria transmitted? How is malaria diagnosed? Can malaria be prevented? And we also discuss the medical treatments available in India. In India, malaria treatment generally involves prompt diagnosis and prompt treatment using first-line anti-malarial drugs like chloroquine or also uncomplicated malaria cases. This is for uncomplicated malaria cases. The government has taken many initiatives to eliminate malaria and achieve malaria-free status by 2030. Up on your screens, we'll have the hospitals which deal with this. All India Institute of Medical Sciences, Delhi, Aruna Asif Ali Government Hospital, Delhi, Deen Dayal Upadhyay Hospital, Delhi, and Postgraduate Institute of Medical Education and Research, Chandigarh. To help us understand malaria better and also how grave this can get, we're joined in by guests. We're joined in by Dr. Sunil M Raheja, Director, Internal Medicine, Moolchand Hospital, Delhi.
Namaskar.
He's also former DGHS and MS, GB Pant Hospital. Namaskar, sir. And also we're joined in by Dr.
Namaskar.
Naresh Gupta, former Director and Professor, Department of Medicine, Maulana Azad Medical College. Both of us are joining virtually. Thank you so much, both of you, for joining us this afternoon. Dr. Raheja, to begin with, I would want you to explain to our viewers what causes malaria, how is it transmitted?
Malaria is a mosquito-borne disease and it is transmitted via the bite of a infected Anopheles mosquito. And this mosquito bites in the night after the sunset and before the sunrise. So once there is a infection with this Plasmodium vivax or falciparum, which are the two main types which are prominent in India, vivax being the more common and Plasmodium falciparum is more common in the northeast India. So once the patient is infected, it undergoes the incubation period. That means the virus multiplies within the body of the patient, and the patient will have the signs and symptoms of, as you very well told, high-grade fever with chills and rigor, body ache, headache, and in more complicated cases, it can lead to the cerebral malaria, in which the patient can get drowsy, or maybe there is a bleeding in the urine, hematuria, and all that sort of things happen. So this is a very, very complicated malaria can also happen in some of the cases if they are not treated on time. But I would like to convey here to all the people of the nation that the treatment of malaria is now very much advanced. And whenever you have got high-grade fever with chills and rigor, nausea, vomiting, headache, body ache, and abdominal pains, please consult a doctor.
Right.
The early diagnosis and early treatment with the effective medicine like chloroquine and artesunates, you will be cured fast, and also the transmission of the parasite will also stop. So that also helps in overall eradication of malaria.
All right. At this
Besides
point,
this, of course the mosquito breeding should be halted by ensuring that there is no collection of water inside or near to your houses. That and mosquito biting should be prevented, as you very well said, by using the medicated
yes.
mosquito nets and mosquito repellent cream.
All right. I'll take that forward to Dr. Gupta. Dr. Gupta, sir explained to us what causes malaria, but what kinds of malaria are known to exist? Are there any varieties of malaria that are known to exist?
The Plasmodium is a parasite. So we have a Plasmodium vivax, which is the commonest in India, and we have Plasmodium falciparum, which is the deadliest in the world. It occurs in India also. And then we have Plasma malariae. So there are four varieties of plasma. The two are most important, that is the vivax and the falciparum. The vivax causes a lot of disability for the patient. You know, the patients really feel dead. It comes with such chills, rigors, and severe headache, and there is a three-phase pattern. Whereas in falciparum, it is life-threatening for a different reason. Malaria, the parasite, gets into the red cell. And once it gets into the red cell is of no use to the body. If it is of no use to the body eliminates that red cell and makes it into water and throws it out of the body. So imagine if half of the blood cells are infected with malaria, half of the blood will go down in no time. Now,
Right.
this is the kind of scenario that occurs in falciparum. So, if falciparum is there, it affects not only the brain and the other body systems, but it also brings down it takes up the risk level because there is a very severe anemia also. So, there are four varieties. Two varieties are more common, and the deadliest is falciparum, the commonest is vivax, and the other ones present with a different pattern called the malaria, Plasmodium malariae and Plasmodium quartan.
All right, Dr. Gupta, how soon can a person feel sick after being bitten by a mosquito? Explain to us the early signs and symptoms that are visible.
Unfortunately, the person does not start feeling sick the moment he is bitten by a mosquito. Mosquito is very smart, and it's a smart female mosquito. The female mosquito is the one that causes malaria.
Yes.
Where before they bite, they inject something called an anesthetic agent there. They also inject something that lets the blood not clot so that they can keep sucking. So when the mosquito is biting, it may not always be possible to feel the discomfort, except maybe small little bites sometimes, and you forget about it. Then there is an incubation period, because after the bite, the malaria does not go straight into the blood and develops into this pattern. It might take a week for it to develop. So once it takes up to a week, let's say, to develop, then this is the time when malaria is dividing in the body. It's kind of building up the army in the body.
Right.
When it builds up the army, then it starts throwing all into the open system and create havoc. This is the one that causes fever, because when the body is attacked by these thousands, several thousand of these malaria bugs in the blood, they have to react. And once they react, they create their own army, the body's protection army. And when the fight occurs, that fight results in the fever.
Right.
The fever is very typical, that it comes all of a sudden. And because the fight is big, the fever goes up very fast within minutes. And that is when you get the chills and rigors. Now, this fever goes very high, couple of hours. It would cause headache, body ache, shivering. They just want to have blanket and quilts even during the peak of summer. And then it comes down with sweat. In between, there is severe headache. The problem also is, in the initial 2-3 days, this pattern may not be setting in. It might take some 3 days to set in. So for 2-3 days, it might look like any other fever, and that is where the complexity comes in, that you may not be able to diagnose it in the beginning. After 3 days, this pattern becomes so established that one day the patient develops chills and rigors and a fever of 104, 105, 106, 40, 42, 41 degrees. And then it comes down in a couple of hours with sweating. He feels tired, but he takes liquids and he feels fine. Next day, there may be no fever.
Right.
And then third day, again it comes. So that pattern sets in after a few days. And once the pattern sets in, many times the families would recognize it, or the locality will recognize it, because it may be a malaria affecting not one out of the many, but malaria occurs because of what we say bad water. Unlike the dengue, which is
Yes.
clean water. So bad water, once it occurs, it might be in bad areas where the drainage is suffering or the water is getting collected and infected and smelling. There the fever comes, and these persons, the residents, would recognize that it's an alternative fever, so it could be malaria.
Right.
But remember, it also is the time scenario when the bad water or bad scenario, the sewage, might even give rise to other diseases in addition to malaria or instead of malaria. So the recognition could be easy if they are there, or if the doctor is aware of it, or if it is occurring in an environment where malaria is transmissible. So you know
Right.
that malaria, this would be the time, so then you can suspect it.
All right.
Once you suspect it, sorry, yeah.
Right. I'll take that forward to Dr. Raheja. Dr. Raheja, sir, Dr. Gupta explained to us the incubation period. Now, during this incubation period, can a person transmit malaria to other people also before the symptoms actually appear?
Yes, definitely. The person, what you call is having the parasite in the blood even before the onset of fever and after the onset of fever. So, this is why I tell, whenever you have a high grade fever with chills, as Dr. Gupta said, with rigors like shivering, you must consult the nearest medical facilities at the earliest, because this is the stage when the person can transmit the Plasmodium vivax or falciparum, which is more common in India, through the female Anopheles mosquito. And again, it will go the incubation period in the mosquito stomach, and then it will again get the mosquito will become infective to another person whomsoever it bites. So this is the time where we have to focus hard. We have to treat the patient early. And nowadays the test is very simple. You have to go to the nearest health facility, get your blood tested. There is just a simple 1-drop peripheral smear test by which you can make out which kind of malaria it is, vivax or falciparum, and accordingly your doctor can start the medication, anti-malarials. Or there is a malaria antigen test also, malarial antigen for vivax and falciparum, and immediately the doctor will get to know. This is how we treat these patients of fever coming to us during this period in summer and in rainy seasons, when there are increase in the mosquito borne diseases. Like at this, patient may be having a dengue fever also, which also mimics similar, but dengue mosquito bites in the daytime, whereas malaria mosquito bites in the night. So please ensure that there is no mosquito breeding inside or near to your houses. And once you get your blood tested, we have to understand that treatment of malaria is very advanced, very simple. Only you have to take a certain amount of medication like chloroquine or artesunate group of drugs for falciparum malaria, and you will be all right within 48 to 72 hours. And if you patient takes the treatment early, it is less than it won't be infective after 48 or 72 hours. So this is where the government of India is also working very hard in the malaria eradication program. This is one of the strategies for malaria elimination.
Yes.
Because if the person who is already infected with the Plasmodium vivax or falciparum malarial parasite, if person becomes non-infective at a very early stage by the early treatment, what we say, hit early, hit hard, hit in time, don't delay, because moment you delay the treatment to the anti-malarial drugs, the patient can develop so many complications, as Dr. Gupta said, and at the same time the patient will be infective to the other persons also through the bite of female Anopheles mosquito. So we have to understand that we must take right treatment at the right time, at the earliest, under the supervision of a doctor. And these tests are very easily available at the primary level, primary health centers, district health centers, and of course, in bigger cities and metro cities, it is a step away from your door. So please don't ignore any kind of fever these days, because what as a physician we are getting is fever in during this period. A person can have malaria. Which type of malaria we can very easily diagnose and start the treatment. The patient can have dengue, the patient can have typhoid fever. So we take the detailed history. If the
Yes.
patient has a typical pattern of fever, like high grade fever with chill, shivering, and there is the alternate pattern, every third day the fever again comes. So it looks like malaria. This
All
the
right.
physician gets to know. And if there is a step ladder increase in patient's fever, it looks like enteric fever or the typhoid fever. And if there is a continuous saddleback fever, like there is a fever, then there is a febrile phase when there is no fever, and then the fever comes back again with severe body ache, chills, headache, nausea, then it is dengue. So
Right. So the
ultimately, even as a physician, as a doctor, we have to take a final call after the blood test examination, and these tests are easily available, very easily available, and you can get the result within 4 to 6 hours, and you can treat the patient on rational
All right, so the symptoms should not
drugs.
be taken lightly. But Dr. Gupta, what is the status of the vaccine on malaria? And also, can a person through the course of his life, by changes in lifestyle or by eating habits, can a person develop immunity against malaria?
See, that's a very difficult question. I mean, the vaccine is also difficult, and developing immunity is also difficult. One of the things is the virus that causes dengue, it leaves behind a immunity which is lifelong for that person. So if there is a variety of dengue that patient gets, they will not get that dengue again lifelong. But you cannot say the same thing for the malaria. In our system, we can create a immunity by giving vaccines. But I believe in the alternative systems of AIIMS, they can generate a immunity which is generic and which will prevent against any of these,
Right.
malaria also. The problem with malaria is twofold. One is whenever there is fever, anybody, they might consult a doctor, or they would consult anybody nearby, quack or alternative system, or a chemist, pharmacist, and they take the treatment. Very often, they land up taking antibiotics. Now, malaria is one disease which does not get helped by antibiotic. Otherwise, infections anywhere could be to a smaller or a larger extent be benefiting. So we have seen cases of malaria which just go on for 1 week, 2 weeks, and they are not getting diagnosed. And the reason also is, as Dr. Raheja said, the test is very simple. The blood smear, peripheral blood smear, very, very simple test. But sadly, it is either not widely available or not properly done. Otherwise, there is no reason why we should be missing on these tests. The rapid
Right.
diagnostic tests for blood were advocated by WHO many decades back. But they are not a replacement for the blood smear, which is a very specific test which not only diagnoses malaria, but which also tells you whether it is Plasmodium vivax or it is Plasmodium falciparum. The two have different treatment. If you don't treat falciparum, the blood will get lysed, it will get converted into water,
All
and
right.
the transfusion will become more important. The urine itself will become black. We call it black water fever. So it becomes black because the blood that gets lysed actually gives rise to a dark red or
All
a brown
right.
color in the urine. So these problems are there, but the immunity one can develop by having a good lifestyle.
Right.
So if you have a good lifestyle, your body will fight it. But your body may not be able to defend the onslaught of this lady Anopheles that is carrying all these bugs.
All
And
right.
that is where you will need the treatment. The
Yes.
vaccine for dengue and vaccine for malaria are in the pipeline, and they would all be coming. But personally, I feel that preventing malaria from your surrounding will prevent you not only from malaria, but maybe dozens of other diseases which emanate from the bad environment or bad
Yes, on
water,
our
as we
screens, we are
call it.
also showing our viewers how malaria can be prevented. But Dr. Raheja, does malaria also affect the animals?
Yes, of course. Malaria is a worldwide disease, and it is more common in the endemic countries like Northeast Asia. So we need to take care. But the transmission of Plasmodium vivax is only from human to mosquito, mosquito to humans. So it is only between man and mosquito. So this is where we emphasize that if we break this cycle of the incubation period in the mosquito by avoiding the mosquito breeding inside our houses or near to our houses, we can prevent not only malaria but also dengue, because
yes.
dengue basically breeds in the fresh stagnant water, whereas malaria can breed in any kind of like stagnant water, as we say bad odor. The malaria in Greek, when it was malaria, the word came from the Greek word maleri, which means bad odor. So wherever there was a poor hygienic conditions and there was a stagnation of water in and around the housing societies, the incidence of malaria will increase. And the most important message I again say that please get your treatment from the medical center with a proper professional degree and professional experience, because early diagnosis is very important, and at the same time your right medicine in the right dose for the right duration is also very important. Because what happens, you take 1 or 2 doses over the counter from the chemist, you feel better, but again you become a carrier of the Plasmodium. So you not only become carrier, but also there is a resistance to the drugs which is coming up, and we are facing a new challenge also. So again, I request the general public for the awareness.
So timely medical intervention
get
is
your
important.
Treatment from an authorized medical facility where a qualified physician or pediatrician is there to treat you in the right time, in the right dose of the medication for the right duration. And again, as Dr. Gupta said, the medication for Plasmodium vivax is different. Plasmodium falciparum, of course, artesunates are there, and there are reports in which we are getting resistance to the artesunates these days, and this will be unfortunate, because we need to use the right dose of drug in the right time. For right duration.
So that was about prevention, that was about transmission, and also both our doctors explained to us how severe and grave malaria can get. We're joined in by Dr. Sunil M Raheja and we're joined in by Dr. Naresh Gupta, and they helped us understand malaria better. And for the benefit of our viewers, we'll have a quick rapid fire round to clear some myths. Dr. Gupta, must a malaria patient be placed under quarantine?
No, the malaria patient need not be placed on quarantine and create problems for everybody else. We need to prevent the transmission, no need otherwise.
Dr. Raheja, once you get malaria, you're immune to it.
No, you will not be immune forever, like Dr. Gupta said.
Yes.
And you need to take precaution, avoid mosquito biting
and
mosquito breeding.
Dr. Gupta, malaria can be prevented by having garlic. Is it so?
No, that's not true. But unfortunately for dengue, for malaria, for many other diseases, we have these things. Garlic may be good, but will not prevent or treat malaria.
All right. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand malaria better. So through this discussion, we did understand that malaria is a major public health problem, accounting for sizable morbidity, mortality and economic loss. But it is also detectable, preventable and curable illness, provided there is no delay in its diagnosis and treatment. If you show signs of malaria, immediately consult your physician and seek confirmation through a microscopic lab blood test for malarial parasites. With that, we end this edition of Wellness Watch here. Till we meet next, take good care of yourselves. Bye-bye.